Washing my hands. Hey, I'm Kinsey. I'm going to be your student PT today.
Okay.
Is it okay if I work with you?
Yes.
Can you tell me your name and date of birth, please?
Ali, April 18th, 2001.
Okay. So today I'm going to be demonstrating how to do patellar mobility techniques and patellar taping.
Okay.
So the first thing I want to do is go over indications and contraindications. Indications would include patellofemoral pain syndrome, limited patellar mobility, especially in the medial glide direction,
Okay.
lateral patellar tracking, post-op stiffness after knee surgeries, pain with squatting, stairs, or prolonged sitting, which is what you're having today. Contraindications would include like an acute fracture, any suspected DVT or unexplained calf pain, any edema or effusion that is affecting your mobility in the knee, any open wound or anything like that on the taping area, which is your knee, and any recent dislocation, subluxation within the last 6 weeks or an acute fracture. Okay?
Yeah, I don't have any of those.
Perfect. Okay, so typically with this technique, patients are having anterior knee pain with squatting, prolonged sitting, or stair climbing like we talked about. I know you're having pain with squat, so I want to actually look at that and see how your knee moves during it, okay? So I'm gonna have you do a squat in the camera view. And can you remind me which side it is?
It is this.
Okay, the lights just went off. Okay, so I'm gonna have you do a squat, and I'm gonna look at your knee when you go down, okay? Was that the pain that you're having?
Yeah.
In the front of your knee?
Yeah.
Okay. I noticed, you can go ahead and have a seat. I noticed when you're squatting that your knee cap kind of goes outward, which is what we call lateral tracking.
Okay.
So I'm going to look at range of motion, mobility, and then tape your knee to hopefully help with that.
Okay.
So I'm going to have you lay on your back. The first thing I want to do is look at your range of motion.
Okay.
So I'm going to have you bring your heel to your bottom as far as you can. Okay, good. We got about 115. The next thing I'm going to do is I'm just going to place this towel roll under your knee just for comfort purposes. The next thing we're going to do is assess your knee mobility because we noticed that tracking with your squat. I just want to take a look at every direction. So the first direction I'm going to do is superior, which means up, inferior, which means down, medial, which means towards your other leg, and lateral, which means towards me, okay?
Okay.
So I'm going to use the inside of my fingers for up and down. Just on that kneecap, we're going to go up. We're going to go down. Then I'm going to use the tips of my fingers to look at medial and lateral. We're going to go medially. We're going to go laterally. Yeah, so it moves a lot farther laterally than it does medially. So what we're gonna do is we're just gonna work on your joint mobility. I'm gonna do oscillations for about 30 to 45 seconds, and we're gonna do those 2 to 3 times, okay?
Okay.
If it starts to hurt at any point, just let me know, okay? So we're gonna do them in the medial and lateral direction. Does that feel okay?
Yeah, that feels fine.
Still okay?
Yeah.
Okay, that's one rep of it. Now I'm gonna do this way. I'm actually gonna go medially again.
Okay.
For your second time.
Okay.
And then after that, we will tape your knee.
Okay.
And reassess.
Perfect.
Okay. Sorry, my camera's a little weird, so I'm gonna move it real fast. Okay, next we're gonna do what we call McConnell taping. And what that's gonna do is just help, hopefully, sometimes it works, sometimes it doesn't, it just depends on the patient. This is gonna help improve your patellar alignment and hopefully reduce your pain.
Okay.
So I'm just gonna have you remain in that relaxed position with your slight knee flexion.
Okay.
Your skin is clear and dry. And then the first thing we do is we're gonna put some of this tape. This is gonna be the only thing touching your skin.
Okay.
It's just gonna sit relaxed on there, okay?
Okay.
It shouldn't feel weird. So let me know if it does.
Okay.
So with this, we're gonna go a little bit longer than the length of your kneecap. I'm not sure why it's doing that. Oh, I've got these terrible scissors here. Oh, actually, these are good. Just a little bit wider than the length of your kneecap. I'm gonna cut that. And then I'm gonna measure one more piece that width. Okay. So as I said, this just goes, it just sits on your kneecap. And you're gonna notice there's some wrinkles in it, and that's okay. This is just like an anchor.
Okay.
Does that feel okay?
Yeah.
And then we're gonna put one more piece down. Okay, does that feel okay?
Yeah.
Okay, next we're gonna use this rigid tape. It kind of feels like duct tape, which might feel weird.
Okay.
But what we're gonna do is we are going to basically have the tape pull your knee a little more medially.
Okay.
To try to prevent that lateral tracking when you're doing your squats, which
Okay.
is causing you pain, okay?
Okay.
So we cut this one a little shorter than the white tape. And we're gonna start on the outside of your kneecap and pull it in. Another piece. Is that feeling okay?
Yeah.
That piece might be too short. We're gonna go about 3/4 of the way on that other piece again, and just apply the force in that medial direction to try to hold your kneecap in place. Does it feel weird?
It feels
Good?
good. Yeah.
Good. Okay. Now I'm gonna move all this stuff out of the way. And while you're laying down, I'm just gonna go ahead and relook at that patellar mobility
Okay.
and your range of motion, okay?
Okay.
Yeah, we're getting less of a lateral glide, which is our goal.
Mhm.
Everything else looks good. I'm gonna remove this towel roll. We're gonna look at that knee range of motion. So just bring your foot towards your bottom as far as you can. Let me know if that tape feels weird at all.
It feels fine.
Okay. You have a little bit less range of motion on that side, but that kind of makes sense because the knee is restricting
Yeah. Yeah.
the movement that we
Yeah.
don't want. So the next thing I want to do is just reassess your squat and
Okay.
see how that feels.
Okay.
Again, this may or may not work, but we definitely don't want it to feel worse.
Okay.
So I'm going to have you stand up and perform another squat. Okay. So I'm going to come over here and watch your knee.
Okay. Ready?
Yeah.
Feels a lot better.
It does it?
Yeah, yeah.
Okay, good.
Yeah.
Okay, one more thing I want to do before we go is I want to do an exercise.
Okay.
This is what we call TKE, which stands for terminal knee extension. Forgot this side of the bed doesn't work. What that's gonna do is it's gonna help activate your quad muscles. We really want to activate the inside because if it's not working, that can allow your knee to go more laterally like we talked
Okay.
about. So what I'm gonna do is I'm going to place this band around your foot. And we're gonna put it behind your knee, and I want you to step up towards this pole, kind of. feel a little weird, but we're just gonna attach it on the pole. And I'm gonna, actually, let me drop this down. Get it out of the way. Okay, now I want you to kind of stand facing the bed, sorry, this way, and you're standing perfect where the clamshell band is taut.
Okay.
And what we're gonna do is you're gonna relax your leg, and then I want you to pull it straight back, pushing against the band.
Okay.
Do you feel that in your knee?
Yeah, I do.
Okay. We're gonna do this 3 sets of 15 reps, just working on the endurance of the muscle to hopefully be able, we're gonna strengthen and work on the endurance of your muscle to help the tracking of your patella. So again, we're gonna do that 3 sets of 15. I want you to do these once a day, about 4 to 5 times a week, okay?
Okay.
We're gonna print out that exercise and send it home with you.
That was 1 set. I'll start my next one.
Okay. Also, when you're doing it, you wanna make sure you're squeezing the quad and pulling your kneecap upward.
Okay.
Which is what happens when you contract your quad. You wanna make sure that you're not locking the knee super aggressive
Okay.
and causing extra pain. I'm gonna go over the expected outcomes of the taping and the mobility.
Okay. I'll
This
start
would-
my last set.
Okay. This is expected to improve your patella mobility, like we talked about, reduce your pain with functional movements such as squatting, sitting for a long time, or going up and down the stairs, better patellar tracking, and increased comfort with the squatting like you had.
Okay.
So if that helped your pain, we want to keep it on, but if it's making it worse, just take it off, okay?
Okay.
Are you done?
Yeah, I'm done.
Okay, great job.